Good afternoon, everyone. Thank you for joining us today. It's a wonderful fall. I will say fall. Is that okay to say, Heather? Fall New England day. You're,
Too soon.
yeah, we're wishing it was still that 80, maybe 90. And we all need a little rain, but we're very excited that you're all joining us today. We're expecting a pretty large turnout of prospect future residents, people with interest in knowing more on our guide to choosing a life plan. So we'll be starting in just a minute, and we'll do some introductions, give you a little housekeeping notes, and go through our presentation here. So once we get everyone just about joining, we're expecting a pretty large turnout of people today. So we want to make sure everyone's on the call before we start going through any information. And since we have quite a bit to cover, I think we'll get started. How's that? All right. So good afternoon. My name is Dan Witham. I'm the Director of Sales for the RiverWoods Group. Been with RiverWoods just a little over 3 years. And then we have my colleague, our Director of Marketing, Heather Phillips. You don't always see her in the front portion, but she's the one that does a lot of our great content planning, social media, and more. So you'll be hearing from Heather throughout this presentation as well. So the two of us will take you through the next hour to really learn more and about choosing a life care plan or life care community. Some of you are very familiar with RiverWoods programs. Everyone today is on mute, but certainly we do invite questions on the topic of today or something you want to know more about. So at the bottom of your screen, there is a Q&A box. So please feel free to use that box to put in any questions that you think of on today's program that Heather or myself can answer at the end. So we'll leave a little bit of time for questions. And any questions that we might not get to today, certainly we do get a copy of all of them and we will make sure someone responds back to you. So your questions will be answered. We also look for suggestions or ways to improve our programming, whether that's a new idea or topic. Though Heather creates some great content, but we're always looking for what's that next best thing or what is on the mind of our prospects and future residents that are attending today's event. So please use the Q&A box down below as well to put any suggestions or ideas for future topics. So I appreciate that very much. So for some of you, this could be a slight recap. For some of you, this is something you're seeing for the very first time. So how RiverWoods began. RiverWoods has been around for just about 31 years as of this year. RiverWoods was founded between these two wonderful women you see on the screen. Rosemary Coffin, the lady on the left from Exeter, New Hampshire, and Mariana Hatch from Durham, New Hampshire. These two ladies were crusaders in their time back in the late 80s, coming together as individuals and then as putting together a community. So they really wanted to look at the way that their lives were trending and really how to create a vibrant community to support one another, their family, friends, peace of mind, and then that healthcare component when their lives started to change. So their dream came true when they opened our first campus in Exeter, New Hampshire, RiverWoods Exeter, the Woods campus back in 1994. Since then, we have added on in Exeter with 2 additional campuses and then 2 additional communities in Manchester and Durham, New Hampshire. Mariana's dream was really realized when RiverWoods Durham was opened in November of 2019. So her hometown of Durham, New Hampshire, having that come true and seeing where RiverWoods is today and where it all began back in the late 80s. As I mentioned, RiverWoods today is we call a system of 3 not-for-profit communities, all located here in the state of New Hampshire. RiverWoods Exeter, again, our founding community, started in 1994 with our Woods campus. The Ridge campus came in 10 years later, and then the Boulder 6 years after the Ridge. That community is made up of almost 400 apartments and cottages and over 600 residents that live in that community. RiverWoods Manchester was affiliated with RiverWoods back in the late 2017, 2018 area. It was called Birch Hill prior to RiverWoods and then rebranded to RiverWoods Manchester in 2021. That community is 136 homes or apartments plus 22 outlying cottages. And then we have RiverWoods Durham, our newest community, by 5.5 years, opened in November of 2019, just prior to that kind of time in 2020 that we're all looking forward to forgetting about. But so that community has thrived. It's 150 independent living apartments, in that community, plus newly anticipated some new construction that we can certainly talk about a little later in the program, 55 new homes in 2 hybrid buildings, plus a community center and clubhouse expected by 2027. So a little teaser there for some information upcoming there. All of our communities are, again, a not-for-profit system of communities, individually, financially of each other as well, located all here in the state of New Hampshire. RiverWoods today, as I was telling you, as a not-for-profit, we have a CCRC. You'll hear that word mentioned quite a bit today, Continuing Care Retirement Community Board. Think of our operations board as a 14-member board, including residents from our 3 communities. They consult with our system CEO. Her name is Justine Vogel. Some of you may know her name or may have met her at some point in time. She has been with the RiverWoods system for over 31 years and CEO since 2007. And then our systems board, which focuses on our future mission, growth opportunities, whether that's through community or additional programs and services. And we'll mention a few of those services at the end of the program today. We also have the RiverWoods Group, being a system of communities. Again, each community is individually financial, but the system or the RiverWoods Group provides fee-based services back to our 3 communities. Things like finance, IT, human resources, marketing, and quality control. So our system really provides those services so each community gets the benefit of the larger system and not having to have all those services individualized per community. They also form any at-risk fund, any at-risk portions of any new projects or ventures for the community. And again, as I noted, each community is financially independent of one another, but additional funds can be provided to the group on a case-by-case basis. Today's agenda for some of you, again, we're going to talk about some facts about aging today, where things are today, where things are going. What is a continuing care retirement community or life care community concept? Why this is the time to learn more and plan ahead as wait times continue to increase at all of our communities, RiverWoods, and around our New England communities and around the country. Types of contracts, always good to know the different types of contracts. There are multiple contracts. As people say, if you visit one continuing care retirement community, you visited one because they're all so different. The options that are available to you at each community, and then a chance to answer questions at the end of our program today. So I'm now going to turn it over to my colleague, Heather, who is going to take you through some current facts, and then I will join you back in just a few moments.
Hi, everybody. I'm so excited to be here. I get to talk a little bit about the age wave and the numbers of aging right now that we we have in our demographics. So to start, I wanted to talk a little bit about the boom that we're having with the appropriately named baby boomers. So each day, the U.S. has 11,400 people who are turning 65. We have never seen a volume increase as quickly as of older adults as we're currently seeing today. In 2030, 1 in 5 Americans will be 65 or older. Those aged 85 and up is projected to nearly double by 2060, and the demand for home health and personal care aides are expected to grow 33% by 2029. This is far going to outpace the workforce that we have available. The numbers shown here on this chart reflect the total number of people that are going to be in the workforce. It's not individual specific to senior living industry. So if you are considering relying on care at home, you have to understand that it's going to get more and more expensive and more difficult in the future years. Life care communities can provide reliable on-site care, allowing peace of mind for the long term. Solo aging is also increasing. Year over year, social connections are more and more critical than ever. Community really is the secret sauce to living better and longer. Life care communities can offer that. We have friendship, there's fun, there is countless activities, clubs, opportunities to explore, tons of interests, continue education, while minimizing the potential for isolation and for loneliness. Life care communities also ensure that help is always nearby, supporting both physical and emotional health. So you'll enjoy freedom to live fully, but you'll also have the security of knowing that you're not on your own. So it's a fact that most of us are going to need some sort of support as we age. About 70% of individuals turning 65 will need some form of long-term care in their lifetime. And this is something that can particularly impact couples who can be vulnerable to this. When one spouse needs care, often it can affect both spouses. So planning ahead can help ensure both of you. It will ensure that you are receiving support, but while you're also staying in control of the care that you're receiving. So, some other facts about aging, making choices right now about your future can also ensure a supportive environment when the care is needed. A significant portion of 65-year-olds, about 22%, will need longer term care for more than 5 years, and women, again, are more vulnerable. This is often due to a longer life expectancy. Nursing home care, once needed, can be a very expensive cost. This can average about $8,300 a month, and the cost can rise over time as care needs change. At life care communities like RiverWoods, you would pay a predictable monthly fee that covers independent living and then access to higher cares levels of care when needed. So planning ahead allows you to avoid unexpected spikes in long-term care expenses.
Perfect. And I can take the over the next few slides here for you, Heather. Here.
Sure.
Perfect. Thank you. So we also like to talk, a lot of people know of Medicare and long-term care insurance. So we just like to share a few facts on those for people. Many people believe that Medicare will cover their costs. And of course, that is not really accurate. Medicare generally covers acute medical stays or hospital stays and skilled nursing. Generally does not pay typically for assisted living or other types of services. And it's usually following a hospitalization, doctor's visit, or certain types of therapies. And also doesn't provide for long-term ongoing daily assistance as people go forward. Long-term care insurance, a lot of people in a certain generation have had long-term care insurance when the plans were very affordable, though pricing and terms have changed a lot over the last few years. Long-term care insurance is a great bridge for people. It does provide an option as people age and need services to cover those fixed costs for a fixed amount of time, but doesn't guarantee where that service will take place. So continuing care retirement communities do offer not only that long-term care insurance type of option for people on our life care contracts, but also where it's going to take place. So your living environment and the care that you're going to need for the balance of your life. Again, as Heather said on her earlier slide, 70% of the estimated population will need future care. And those numbers continue to change all the time, but currently it's a pretty large portion of us that will need more care as time goes on. Long-term care insurance, as I said, it's that bridge to the future, provides that fixed financial coverage for a specified period of time, generally for higher levels of care, assisted living, memory care, nursing care, sometimes home health care based upon your terms of your contract. Again, it does not answer the question of where the service will be provided. And as Heather mentioned on a couple earlier slides, where that labor market is diminishing, where are those people going to come from? In community, we already have fixed community costs and knowing where people are coming on a monthly basis, where when you need that help, is it going to be around your area and your location that you're going to need? So again, talking about life care communities, continuing retirement, give you that peace of mind, knowing that you have a location, you know the care will take place in that location, peace of mind for yourselves, your partners, your loved ones, and your children as well. So again, cost, quality, availability, location really are answered with a life care community contract. What is an older adult to do? I think this is a great slide to really give people options, and everyone has to consider what option is best for them as they continue to age. The number one thing we hear quite often is, "I want to stay at home." And certainly, no one wants to leave their home, especially if you lived in your home for a long period of time. We have residents that have given up homes 40, 50, 60 years, moving into community. Again, home has that safe environment to people, but again, as you continue over time, homes become hard to maintain. Finding services, bringing in help, whether that's through social services or needing roof repairs, mowing your lawn, snow shoveling, all those fun things that you do when you stay in your home. The second option for some people is to stay at home to bring in, we call anticipated services. I'm going to bring in help when I need it. Certainly, it is a great option. If you can find those services, if you have long-term care insurance, your pricing can be paid that way. Again, socialization, isolation are important things to think about. As you stay in your home and as you age, your group of friends gets smaller and smaller, and family members are just not around the corner like they once were. More people have moved away or are not in their local location any longer. It brings us to cohabitate. Another option is I can move in with my children or maybe a sister or brother. Sounds really good in theory, but have you asked them that question, first of all? Or do they anticipate that question? Many children have very busy lives, working sometimes one or two jobs, children, moving parts. So having someone around on a regular basis, and do they live in a multi-level home? Are the bedrooms and bathrooms on different levels? So things to consider, not to say cohabitation is not possible, but things to consider as people age. Homes were not made for aging people over a long period of time with health conditions that can continue to change. The option of seeking out care when you need it, assisted living and nursing homes certainly is another option. We call sometimes almost a crisis situation where you're not anticipating needing that higher level of care and then it springs up upon you. So having to make a decision on a short-term basis, whether it's help with family members or making a decision on your own to say, I need that care level. Selling your home on a short notice, moving to a place you're not familiar. A lot of things are really difficult with a crisis or short-term situation. And then you come to CCRCs or continuing care retirement communities, where you plan ahead. You're making a plan now. So as you're continuing to age, you know where that next location will be. You'll have that sense of socialization. You'll have access to activities and dining, and no worry about taking care of that home any longer. And your family members will appreciate that more than you will ever know in that particular case. The CCRC landscape across the country continues to change. CCRCs have been around for a number of years now, longer than some people realize, started in the state of Pennsylvania with the Quakers, and now has moved on to around the country. The biggest growth areas now are in the Midwest and the South because of land availability, where you'll see less in the Northeast by trade. There are about 1,900 to just under 2,000 continuing care retirement communities across the country. Most are in the not-for-profit sector, like RiverWoods is, but there are for-profit communities around the country as well. Here in the state of New Hampshire, we have 13 that cover the state of New Hampshire. Again, we have some that are faith-based or affinity-based in the not-for-profit sector, community-based nonprofits, and then some for-profits. We're going to talk about the different types of CCRCs and what services they offer moving forward. I also like to mention, because we live in a fantastic state here in the state of New Hampshire, when you're looking at your future options of where in the country are you looking to move, we have many people that are from the greater New England market from at RiverWoods, and then we're seeing an expansion of people moving in from further distances, all the way from California, Arizona, Texas, Florida, the Carolinas, for many of these reasons that you see on this slide. Our beauty, our state location, having access to the Boston Medical Network for hospitals in Portland, Maine, the financial and tax advantages, many things to think ahead. Financial tax advantages of our state of New Hampshire, no sales tax, no income tax. So it's a very tax-friendly state for many people moving from around the country. Our healthcare resources, as I said, in many of our locations on the Seacoast and the Boston affiliation. So it does provide that peace of mind, that lifestyle. Our four seasons here in the state, having access to an ocean, lakes region, mountains, and urban areas as well. And that safety, New Hampshire is a very safe state to live, as many states across the country are dealing with much conflict and other challenges. As we're talking, what is a continuing care retirement community or life care community? That's the other name. They're generally co-mixed together these days. We are essentially an insurance product. Many people think of us as real estate, but in the end, we are an insurance product guaranteeing you move in as an independent resident and having access to all those higher levels of care in our communities. Our contracts are regulated by the State Department of Insurance. So overseeing our states, our financial performance is reported to the state annually as well. So you are basically prepaying for your care, whether you ever need higher levels of care or not. So it's that particular case. So you're going to have access to independent living for most residents, though we do look at direct admissions from time to time, memory support, nursing care, and some skilled nursing care in our communities. With our entrance fee, a portion of that entrance fee is also some tax deductibility along with the monthly service fee, because you are prepaying or insuring for future medical care. It is a lifestyle choice. You enter when you can live independently, other than some direct admissions to higher levels of care. So free from those home maintenance activities and chores, access to local transportation activities and programs, some great education, dining options, increased social opportunities. That's really one of the biggest reasons why people seek out community, is that socialization as you age, and really staying in control of your life, doing all the things you want to do without the headaches of home maintenance and worry about what your future healthcare may need. With our continuing care retirement communities, you enter when you're independent and able to live safely on your own as a single person or couple or partners or whatever your situation may be. You do have to be 62 years of age in order to be on a wait list or live in our communities. We have 4 levels of care, as I had stated on the previous slide. Most residents do come in as independent residents living their best life in one of our apartments or even a cottage in some cases in our Exeter and Manchester locations. We have full access to all higher levels of care in our RiverWoods communities, so all healthcare resources of assisted living, memory support, and nursing care. Residents can also transition between all 4 levels of care at the same time while in the community as your healthcare needs dictate. We call that sometimes respite care or temporary stay in a healthcare situation. So respite care can be a limited number of days or unlimited based around the contract type. Services and amenities are provided at all levels. Typically, our 2 fees are an entrance fee in our communities. That is our buy-in cost. Highly refundable entrance fee based upon the type of contract and community, anywhere from 70% to 90%. Though there are alternative contract options available to you as well. And then a predictable monthly service fee, as Heather mentioned earlier, that includes most of the services located in the community, from utilities to dining, programming, events, and again, that higher level of care access. Great place to meet new friends, pursue your interests, whether you have interest in art or music. Lots of committees. Usually our communities are full of committees, from 30 to 40 committees and affinity groups. And we also have benevolence. So if someone did move into our community and did have a financial change in their situation, our communities do have a benevolence fund that is written into your contract. So your life care will maintain in our community as long as you do not gift away your money or gamble it away in that particular case. A few services, as I have mentioned, most communities have a full dining plan. Generally, 1 full meal per day is included in most communities. Each community might have a different dining program, but generally 1 full meal a day in independent living. As you move to higher levels of care, it would be 3 meals, breakfast, lunch, and dinner. All maintenance in most communities is generally taken care of by the community. That's interior, exterior. Housekeeping services provided on a bi-weekly basis or other terms, laundry services as well. Transportation services in most communities, it's a really great access as people age and no longer drive, having accessibility to go to your doctor's appointments, grocery store, pharmacy, and more. Fitness programming is another key component. Many people currently have to drive to a gym or the local YMCA, where our communities all have full fitness centers and do fitness programming generally Monday through Friday. So if you're a person that likes classes like yoga, Pilates, Tai Chi, strength and balance, those are generally all provided in your monthly service fees. Lots of programs, committees, things to get involved in. And then all of our communities at RiverWoods have a wellness clinic staffed by an on-site nurse practitioner, registered nurses, and social workers. So really assist you from an independent as you go to higher levels of care. And many of our communities also include all utilities, all taxes, everything. Pretty much that monthly service fee does cover most of your situation living in community. A couple of things, multiple levels of care in one community. As you are seeking out community, if you're looking at other communities outside of RiverWoods, some communities might have one level of additional care, assisted living, might not have a nursing care component, might not have a memory component. So when you are looking at communities, really valuable to make sure that they are going to be able to cover all your levels of care as you need those levels of care. We're going to talk about contract types and what they include on the next slide as well. But always good to know what a community has as resources that can help you move forward in your life. Contract types that we have or have around. Again, we can talk about what RiverWoods has and then another contract type that we do not currently have. Type A, think of a type A contract as the best form of insurance, the highest level of insurance. It has an entrance fee at our type A community. Again, those refundabilities can go up to 90% down to a 0% or declining balance option for those people who don't want to leave money to their beneficiaries or trusts or other options. A predictable monthly service fee. As you go to higher levels of care in a type A contract, your monthly service fees continue with you, meaning you don't pay a premium, whether market rate or discount market rate, on your healthcare costs. So it really is a very predictable monthly service fee that covers those higher levels of care. Generally, the only increase in costs at higher levels of care is additional meals, again, because most people have 3 meals a day when they're in healthcare. Again, unlimited short-term, long-term healthcare needs, and most services are covered in that monthly service fee. Our RiverWoods Exeter and RiverWoods Durham are samples of type A or type A modified types of contract. We have a type B contract. RiverWoods Manchester community is a type B contract. Basically has an entrance fee, very similar to a type A. Refundability based around the community. Our RiverWoods Manchester is a 70% refundable contract by nature. As an independent resident, you have a monthly service fee. And as you go to higher levels of care, you would get a discount off market rate. So that type B contract is really good for people who say, I don't want to pay as much up front, but I want that option to have that higher level of care at a discounted rate when I need it. So not paying as much in your monthly service fees until the time you need that higher level of care. It's also a flex contract in our RiverWoods Manchester location, meaning some of that refundable entrance fee can be used to offset your increase in costs. And then there's a type C contract. We don't have that at our RiverWoods communities. Think of that as a rental contract. One rate as an independent resident and a complete different rate or market rate when you need higher levels of care. So again, these are typically the 3 types of contracts you'll see when you're looking at communities. Refundability will be slightly different. Monthly service fees typically built around the size of the apartment or cottage. And you'll see entrance fees can change from community to community based around when the community was built. So a new community moving in today, you'll see the entrance fees are going to be slightly higher because of the cost of construction and real estate these days. And then a few more things here, and then I'm going to turn it back over to Heather for some more great detail and information. Why does a CCRC matter and how does it add up? So as you're looking in future life care needs, the increased cost of medical coverage, everything these days has a higher cost than it did even 2 years ago. So your costs will continue to increase in a life care community. That kind of life care community contract really kind of says this is what your costs are going to be. There are increases from year to year, but not significant, and those are all planned out in advance. It increases your longevity. People are living longer. So your plans should start now, again, with wait times ranging from some communities with 6 months to a year to some communities over 12 years wait time. So really taking action now is something people really should look at, or at least start that process based upon where you are. And again, higher lifetime medical and long-term care costs, even if you have that insurance product, long-term care insurance, those costs continue to go up. So having a life care community really does matter. Again, we're seeing more people silver, tsunami, we hear a lot of different things. The baby boomers are coming into retirement age and seeking out community. They have dealt with family members that have been in community before. So again, looking ahead. People now have dual career couples, full schedules, family lives further away than they ever have before. And same with children, that people do move way more than they used to. People used to settle in one place and be there for a long period of time. So good to think of options ahead of when the time that you're going to need it. I'm going to turn it back over to my colleague Heather, who's going to take you through the next series of slides.
So I think one of the things that we are very sensitive to is that planning really can be intimidating, but we're here to help you through the process as much as possible. There was a survey done that had asked people who stayed at home if they had to do over, would they? And many people said no for the reasons on this slide. They didn't want to admit that the care was needed when it was needed. The timing of the long care need was unforeseen and unexpected, as it often is. They didn't want to talk about it. I think that can be something that's really hard is how do you approach your family members? How do you start to plan with your partner about making a change that is this large? But it should be talked about. A lot of people had thought that they had more time, and a lot of people hoped that the issue would resolve itself. But um, if you've made a plan, you have to understand that the next 5 to 10 years are probably going to look very different than they do today. But we want to congratulate you because you're here. This is a step. You are now officially joining those that are planners. This is a big part of that. So congratulations. Some of the changes over the incoming years are going to be bad. Some are going to be very good. But right now you have the opportunity to plan intentionally and to make the most of those years. So don't wait for a crisis. Make sure to plan ahead. One of the shocking statistics in adults over 75 is that 8% of people spend their time communicating with others. So if you are solo, these numbers can be even less. You want to be able to anticipate a time frame where you can not only thrive as you age, but flourish. This is an incredible study. It's actually the world's longest study on happiness. It was started in 1938 at Harvard University. And this wonderful book, The Good Life, summarizes that study. Findings show that close relationships, more than money, more than fame, are what keep people happy throughout their lives. Ties to community protect people from depression, from delays in mental and physical decline. They're better predictors of long-term happy lives than social class, than IQ, and then even more so than your genes or DNA. So choosing to build a life of intention that can include social connection, forming and strengthening relationships. It's an essential part of remaining happy and healthy.
I would highly suggest having a copy or reading a copy of that book to anyone on this call today. Some really great resources out there. Understanding the entry process for community is also another big step for people. If you're not familiar, generally for most communities, there are 2 steps. One is a financial assessment for communities, for people to understand if a community is affordable or going to be a financial fit for them. There are different ways of understanding that. We'll talk in a couple slides of one option that we have here at RiverWoods that you can use. Otherwise, you have to provide financial assets, whether you're selling your home. These days, home assets are all-time highs, but as everyone knows, the market can change very quickly. Also, any other income you generate from Social Security, pensions, so anything that is considered an asset or income that would qualify you to live in a community. And then we use actuarial software that would calculate based around your current age and your lifespan in the community, your living expenses over time, from that entrance fee, that highly refundable entrance fee, to monthly service fees and increased cost over time. The other is a healthcare assessment. And again, each community can have different aspects of a health assessment. Again, they vary by community, so you want to ask the community what are the parameters around a health assessment that might be required. Some communities do exclude pre-existing conditions, meaning if you have a diagnosis, some communities might not accept you. RiverWoods does not have any pre-existing conditions excluded. That is our way of working with residents over periods of time. We do still have that health assessment at time of an offer. We will need your medical history, and the assessments are generally done at RiverWoods with an on-site assessment with our nurse practitioners, really to see, to make sure you're safe to live independently in our community. That assessment is both cognitive and physical, and generally done at the time of an offer. Again, communities all can be slightly different in this process. Again, just a good question to ask the community that you're looking at, how that entry process works from a financial perspective and healthcare assessment. RiverWoods many years ago put out a great publication called our Insider's Guide. There is a QR code on the screen. Heather is wonderful with QR codes here, making it easy for all of present people listening today. But certainly if you're not able to access the QR code, reach out to the community. We can provide you a copy. We have a great digital PDF copy that you can look through. This is a great publication that was put out really to help people navigate the continuing care retirement world. Whether it's about contracts, questions to ask, financial impact, studies on services. So it's just a really good resource that all people can have, whether you come to RiverWoods or seek out another community. So again, it's just some really good education. I would tell you from a sales perspective, education is really the number one aspect for people when you're looking at a community, is really to be knowledgeable about what that community looks like now and what that perpetuity would be in the future as well. So please ask for a copy of our Insider's Guide, and certainly we can pass that along to you. Evaluation criteria when you're looking at a continuing care retirement community or life care community. Again, there are a number of aspects to look at, but from a financial side. One is a community for-profit or not-for-profit. Many are in the not-for-profit sector, but some people prefer for-profit over not-for-profit. Not-for-profits, again, kind of continue that, keeping our communities based upon our residents in the community. Occupancy levels. What is the current occupancy state of the community? Do they have a thriving occupancy in the upper 90s, or are they in the mid 60s, looking for people to fill apartments on short notice or no notice? What does their wait list look like? Do they have a wait list? Are there people waiting to fill those apartments as people transition to higher levels of care? Reasons why those are important questions is their refundability. It's nice to know that refundability will come back sooner, as soon as that apartment is reoccupied. So a strong wait list really shows financial strength of a community. What are the conditions of the buildings and grounds? Certainly, we always recommend people coming for a tour before choosing a community, knowing what the community looks like. What are the residents like? The buildings, are they maintained? Do you see areas of concern? Audited financial statements, especially in the not-for-profit sector. RiverWoods posts our audited financial statements on our website. So you can see the last 6 years that are currently available. It's a great way to seek out information, what questions to ask your sales counselor. So really seeing the financial strength of a community through that. Does the community engage in actuarial studies to conduct comprehensive looking ahead? Are they only looking for now? Are they looking ahead? Because people are aging longer and living in community longer. So is the community planning ahead for those next years? Also, is the community looking to expand? Is it just a single standalone community or a system of communities like RiverWoods? And again, can you speak to someone in the finance department if you have questions that a sales counselor might not be able to answer? So some very good kind of check boxes for people as they are seeking out communities. And again, a few other checklist options. Is there refundability on a contract type? What are the options? Is there one option, or do you have multiple options? And what is the best option for you? Other residents, do they have members on the board of trustees? As I mentioned on one of our very early slides, that we do have residents from all three of our communities on the board of trustees. Do they have a resident council in the community, a resident finance committee? Some questions to ask. How involved are residents in decisions in the community? Do they have open conversations with the leadership, or is it decisions are made for the residents in that nature? So what is kind of the dynamics of that relationship between the community and residents? Is the community a new community startup? Like I said earlier, is it a standalone community? Are they worried about what the next 5 or 10 years look like, or are they pretty sound, stable with an active wait list? Can you see survey results? Our RiverWoods Durham community scored in the top percentile across the country with resident satisfaction last year. So resident survey results really do sometimes show some really good key points to look for. Do residents refer a lot of people to live in the community? A really high percentage of our RiverWoods residents do recommend their friends and family members to seek out community, so much that our RiverWoods Exeter community has many second generational residents that live there in the community. What happens if a resident runs out of money? Again, we talked about that a little bit earlier. Is there a benevolence clause in the contract that you're signing so you won't have to ever leave the community? And is the community planning for the future? Are they only active for today, or are they looking in the next 10, 20, 30 years, from everything from staffing perspectives to what the residents in different generations are looking for? Money Gauge. This is a great slide we wanted to add today. This is a new program for RiverWoods managed by My Life Site. So there's a RiverWoods initiative that many people are interested. Is the community affordable for them? Before submitting all your financial information in an official qualification, you can use our Money Gauge option that is on our riverwoodsnh.org website. So it will require you to put in some financial information about your assets and income. It takes only a few minutes, but it will provide you a snapshot of affordability. Again, it does not mean financial qualification, but it will say, is the community a possible fit from an affordability standpoint? So highly recommend you using these. Other communities have very similar situations, but it's a really great option for you who might be in the early stages of just trying to say, is this even affordable from the start before I go too far and make a decision? Mm-hmm. Heather, do you want to kind of take it from here, and then we'll move on to a couple other slides?
I'm happy to. I also just wanted to let everybody know that as you were speaking, Dan, I decided to add some key links into the chat. So the first is your insider's guide. There's a link right there. It does live on our website, so it's searchable as well, but just so that you have that link handy. And then also I added a link for Money Gauge, as Dan was talking about. That's an incredibly helpful tool. I apologize that the URL is so long, but we have it in the chat. So you can click on that and get an understanding of financial implications. So I have the opportunity to get to talk to you a little bit about what's coming next, which is exciting. As Dan had already mentioned, RiverWoods Durham is expanding. We are excited to be adding 55 new homes in 2 new beautiful buildings, along with an additional amenity building for more socializing, more beautiful amenity spaces, and more ways to pursue interests. Construction is anticipated to be completed in 2027. So really now is the time to start considering a beautiful home in that community. So keep that on your radar. RiverWoods Exeter is also planning an expansion as well. A new unified healthcare center will offer neighborhood settings with beautiful common areas and new community amenities. If you're interested in joining any of our wait lists, at one of the 3 communities, don't wait. Each community has a very robust wait list, and now really is the best time to join. And again, you're planning now, so it's it's time, and congratulations again. We also have 2 new initiatives, and RiverWoods Naviguide is the first. It has long been a hope of ours at RiverWoods to be able to serve the community, the greater community, so those that are not only residents, but also beyond that. And Riverwoods Naviguide does just that. It's a membership-based service that pairs older adults and families with a dedicated service coordinator who offers personalized one-on-one guidance. The Naviguide will create personal plans, help members navigate all kinds of things such as healthcare, insurance, arranging in-home services, connecting with trusted resources, and ultimately just reducing the stress and anxiety of that entire process. So if you'd like to learn more, there's a QR code. When I'm done talking, I can also add the links into these programs as well. But that's a really wonderful opportunity for people that are currently at home and need just a little more support. And next, we have Seacoast Dementia Hub. This is brand new. We just launched this in the beginning of September. This is an incredible program. It is grant funded and at no cost to anybody who participates. And what it is designed for, it's a support for caretakers of people who have dementia or dementia-related diseases. So Seacoast Dementia Hub offers dementia caregivers emotional support, access to vetted resources, education. It helps them navigate the complexities of dementia care with confidence. It's again, it's grant funded, and so it would be at no cost to the caregiver. This has, provides understanding, connection, and emotional support during a very difficult journey.
Perfect. Heather, I'm just going to back up a couple slides just to
Sure.
help out here, and then we'll get to questions. I know some people have been adding questions, and I also saw that the group chat option is not available today, so we're going
Oh,
to have to make sure we send them a copy of links, so we'll make sure we get that to those people.
perfect. Okay.
We apologize for that. For people who have interest in learning more, certainly about either RiverWoods in our particular case, or anything that we can assist you with, seek out our website. It's a great resource. That's how many of you might have found us today. Is riverwoodsnh.org is our wonderful website with great resources, information on all three of our communities, finances, our insider's guide. All of that information is on the website. So including Money Gauge too, if you look at financial affordability. We also do generally almost monthly, sometimes bi-monthly 101 sessions. So 101, think of back in your college days, learning about something new. So each community, Riverwoods, Exeter, Manchester, and Durham, does an information 101 session. It's an hour program dedicated to that community to learn about that contract for that community, the resources, the apartments and homes, the services. Really gives you a great inside knowledge before potentially coming for a tour. So if you do a 101, then schedule a tour, it's a great kind of concept to say this is how to go about the process. Scheduling a tour in our communities, reach out to your sales counselor. They can schedule a tour. They generally last about 2 hours based upon the community. To really see the community from the perspective of a resident standpoint, meeting residents, seeing what dining looks like, seeing a home, apartment, or cottage, and the services around the community.
Mhm.
The next step would be to apply financially. We do that through a CDP or confidential data profile to qualify you financially before joining our wait list. When you join a wait list at our community or other communities, there is generally a deposit. We call it a reservation fee. It does have refundability, and it does earn interest if you do move into Riverwoods at some time in the future. And again, as Heather mentioned, our wait times are continuing to change on a regular basis. So planning ahead really is a really important factor for people to consider. So we're going to get to some questions here and see how we can answer some of your questions that you've put in here. So we're going to start going through some of those here. There is a question on long-term care insurance. So I'll take that one, Heather, for us. Someone has a long-term care insurance product. How will that work with RiverWoods in our particular case? So with long-term care insurance, RiverWoods is a self-pay community, meaning you would pay your monthly service fees. as you either bring in home health care or go to higher levels of care, you can submit a claim to your long-term care insurance provider, and they would reimburse you directly. So again, based around your plan, generally some qualifying that would need to take place for that insurance to provide reimbursement to you, but certainly can work well. RiverWoods is a long-term care insurance product. I'll say our RiverWoods Manchester with the Type B contract long-term care insurance is certainly a really good option, because as your fees increase for a discount off market rate, your long-term care insurance would cover that additional charge. So works really well there, but can work in any of our communities. Generally, our rule of thought in Exeter and Durham is to keep the plan for at least 1 year to make sure you're going to be happy living in the community before anything should happen and not have that product to back you up. Heather did talk a little bit about the health center. I don't know if there's anything you want to add more about our RiverWoods Exeter Health Center, Heather.
Yeah, as new dates are available, we will be updating. At this time, we don't have a firm date for that.
Residents are involved in planning activities and programs. So we have community life departments. In all those resident committees, they certainly work with our community life coordinators on planning anything from programmings on-site to off-site excursions. So good question. Lots of activities and things for people to do. I would tell you most residents say there's not a lack of anything to do, just not enough time to do it all in that particular case. Communities are very welcoming, so always good to know. Question on contract types, A, B, C. So can we compare contracts easier? In this program and also in our insider's guide, there is a breakdown of the contract types, the slide that we showed earlier today. So that is really helpful for many people. But certainly, as I said earlier, if you've seen one CCRC or one contract, you've only seen one, because they are so varying differences from refundability to the different levels of care and what those care costs are, if there is increases at all. So, but it's a really good sheet to look at, or look at that insider's guide. I did mention the chat box not working, so
yes,
we apologize for that, because that's not what we want to have happen. There's a question upon a level of refundability, an entrance fee, monthly fee. We prefer 0%. So currently our RiverWoods Exeter and RiverWoods Durham communities have 0% refundability contracts. So if you are interested in that type of contract, you could reach out to one of those two communities and they could give you more detail on how that works. It's slightly different at each community. So to get a little more detail, just reach out to those as well.
Yep.
There's a question on Naviguide. Can you see that one?
Yep, I did. So I just wanted to say, for this one, what I would do is put you directly in touch with Amanda Kelly, who is our Naviguide. She would be able to answer those specific questions. Again, we'll share the links to that. The way to connect to her would be through the website. But if you have any additional questions, don't hesitate to reach out, but she would be able to walk you through the process in greater detail.
Great answer. Amanda's wonderful. Firsthand experience.
She's wonderful.
She's great to work with. A initial call is worth your time quite a bit. Question, yes, the answer is someone asked a question about health insurance. All residents coming to our communities are required to have health insurance. So Medicare, A, B, plus some type of supplemental health insurance. That is a requirement. In that case, most things in your services are covered under your monthly service fee. Some things can be billed to insurance based upon what they are at periods of time, but generally, yes, you have to have your own health insurance. Also, people will have renter's insurance on their personal belongings in their apartment. You don't need property insurance, things like that. So those are the two types of things outside. And of course, if you drive a car, automobile insurance in that particular case as well. Kind of going through some of these.
Yep.
A question on how does it work when you apply for independent living, when your name comes up. Typically, again, with waitlist, some people can be on the waitlist for a number of years. When your name comes to the top, based around your floor plan category or apartment style, RiverWoods, your sales counsel, would reach out to you to check on your readiness, basically. The first call is a readiness call to say, would you be interested in what we have to offer? Our offer process from there, you would have a requalification from a financial perspective and that health assessment that we talked about earlier, and then see the apartment. From there, move-in could take any place from 60 to 90 days based upon an apartment or cottage. So it has some variables to that, but it's kind of a high level kind of oversight in that particular case. So it does happen pretty quickly, and wait lists can be strong, but we don't always take the first person off the wait list many times. It's generally, that's the benefit of having a wait list, is you come when you are ready. That's one of the nicest things with RiverWoods that I can say. Entrance fee refundability. What is this? Care when you die. Entrance fee refundability generally happens when the apartment or cottage is reoccupied. Once a resident passes away at the end of life or leaves the community, and that apartment is reoccupied, and then that refundability would come back to the beneficiaries, trust, whoever you would name in your document. It's a notarized document that you would have with RiverWoods in that case. I think I saw a note. Did the chat box come back up? Is that what I saw, Heather?
Did it?
Potentially. I don't want to say that if that's not true. So, but I thought I saw that. And yes, the follow up to that readiness question, if you are not ready when we make the phone call to you, you remain on the wait list in your position, and that does not count against you. So good question. Quite a common question. When people are on the wait list, it does activate a whole nother list of questions that people have in that particular case. So I thank you for that. Just going through any more here to make sure I didn't miss too many. Unless there's something I missed, feel free to reach out to me, Heather, and let me know.
You are a pro. You've been going through this much quicker with quicker eyes than I have, but I think we've got everything.
Yeah, it looks like we're pretty good. Yeah. Oops. So yeah, I think we're good. So again, thank you very much for joining our presentation today. We appreciate you being able to attend this today. If you have any questions, please reach out to the community of your interest, to your sales counselor that's been assigned to you, schedule a tour, join our wait list, and go from there. So Heather and myself, thank you for joining us today, and we wish you a wonderful day and hope to see you sometime soon.
Thank you so much.
Bye-bye.